Okay, so this is a lump on, oh, ganglion cyst, definitely. Not a way to drain this though. I'd rather use a syringe, and if it's this large, they need to be excised. Okay, if your girlfriend doesn't pop your foot pimples, then oh, I don't think this is real. I've seen this floating around on the internet. This looks like a clove of garlic that was on the bottom of the foot that was rotten, and they're squeezing it. This is fake. All right, so we are looking at hardware, which is a plate and screws used to fix a fibular fracture. And this is very common. However, in this patient, it's extremely superficial and very close to the skin. You can see the screws are actually starting to push their way out, and this probably needs removed. Okay, so this was actually a patient that was sent to me for a second opinion, and this patient had hammertoe surgery done multiple times, and numerous bones were removed from the toes in efforts to reduce the hammertoe deformity. And you can see the toes are now very unstable, and it was a failed hammertoe procedure that failed multiple times. And at this point, there's really nothing else we can do for the patient other than to amputate the toes. And if we amputated the toes, then we'd only be left with the big toe, so we would most likely perform a transmetatarsal amputation, amputating all 5 of the toes. So unfortunately, there was nothing we could do, and the patient elected to keep all of her toes. What's happening here? This says a piece of glass was stuck in my foot for almost a year. And yeah, that can happen. Surprisingly, you can get a foreign body in your skin or in your foot especially, that's the most common area, from stepping on something, and it can remain in there for up to a year without getting infected. If it doesn't get infected, your body can try to push it out or wall it off by sending white blood cells to this area if there was infection. In this case, there's not, and they're doing the right thing. They're kind of squeezing it to see if it'll come out, because again, the body will send fluid around the foreign body. Oh, there it is. It's a piece of glass. At least that's what it looked like. Let's see. Yeah, definitely a piece of glass. And this is common. I've seen metal or needles in the foot that have been there for 60 years in patients. I'll have that in a video that's coming soon. And so this patient has a bunion deformity, but she is actually complaining of a corn. And the patient thinks that the corn is the problem when actually it's the bunion causing the great toe to move over and push on the second toe, which causes the corn, which is nothing more than a callus. If you like these videos, please make sure to like and subscribe and turn your notifications on. I'll be posting videos daily. I'll be posting short videos, long videos, educational videos, surgical videos, as well as stories about conditions I treat in my office as well as in the operating room.